first I'll tell you how much brain function is involved in visual processing. So for the primary visual processing, around 30% of brain is involved. And if you add on to the eye movement and awareness around the surrounding, that adds up to more than 50% of brain activity. So, it's a large area of the brain that could be involved in visual processing. So damage to any of these areas can lead to impairment. So for vision impairment, the most common is visual field impairment that we see in a lot of patients. So the range could be all the way from 20 to 70% based on the various studies. Typically, what I have seen, around 30% of all stroke patients could have some form of visual field impairment. So they cannot see from both eyes half of their visual field, depending on the location. It may be the right side, maybe the left side, it may be quarter of the vision or the central vision, depending on the location. So beyond the visual field deficit, where they can't see, they could have other problems like visual neglect, which is not in the primary visual cortex area. It's more in the parietal cortical lesions from the stroke predominantly, but it could also happen after traumatic brain injury too. So just keep in mind. Or it could be because of any brain tumor or any lesion in the brain that affect the visual pathway can give you the impairment.